Prevent and treat cervical disc herniation. This is a real-time progression workout lasting about 20 minutes. I invite you to practice with me. Tools. In addition to a familiar yoga mat, you should prepare a very large towel as a support. We start with the diamond pose. Tilt the pelvis forward. The back is naturally straight. We breathe in 4 phases with the lower abdomen during training. Now we're going to turn the head in a circle, about 1 minute, starting in one direction as you wish. Start gently turning your head, still within your own pain tolerance. We will gradually expand this limit over time. Breathe regularly, slowly and deeply in 4 phases with the lower abdomen. Now do the reverse, also for about 1 minute. Now, after exercising to loosen up the neck muscles, we will stretch them in different directions. About 1 minute, slightly compress your lower abdomen and slowly lift your chin toward the ceiling, bending your neck back as much as possible. Deep, powerful 4-phase breathing with lower abdomen to support this neck flexion and stretch. Return to diamond pose. Rest for 1 cycle of 4 breath phases. Slightly compress the lower abdomen. About 1 minute, face straight towards the ceiling. Slowly tilt your head to the right. Eyes slowly turning to look to the right. Always take deep, slow, forceful 4-phase breaths to support neck relaxation processes. Now we do the same for the other side, for the same duration of about 1 minute. Now I turn my head again in diamond pose, rotating in each direction for about 1 minute. Reverse rotation, about 1 minute. Now let's roll up the towel like this. The rolled towel will be placed in this position to act on the neck. We put the rolled towel on the floor and lie on it. Please adjust the rolled towel to a suitable and comfortable position. The size of the rolled up towel should be appropriate, neither too big nor too small, to ensure that when you lie down with your legs bent in this way, your shoulders rest on the floor, your neck on the rolled towel, and your head completely on the floor comfortably. And, when straightening the legs on the floor like this, the head is also pulled and thus lifted off the floor in a natural and comfortable way. When you bend your legs like this, your head will touch the floor again. We will start movements to strengthen the strength and flexibility of the neck muscles, and at the same time adjust the cervical vertebrae to the correct position. About 1 minute, slowly lift your butt off the floor. At this time, the lower cervical vertebrae C5, C6, and C7 will be strongly pressed against the rolled up towel. If you have a serious illness, you will feel a lot of pain, and the pain is directly in this area. If necessary, you can also use both hands to lift the buttocks like this. Adjust the level of buttock lift to the appropriate height to adjust the pressure mentioned above, according to your own pain tolerance. And, when you're really able, especially after a good workout, you can comfortably move your hands up and to the side like this to maximize the release of the shoulder and neck area, enhancing impact positive on the process of self-adjustment and recovery of the cervical spine. Lie on the floor with your legs straight. About 30 seconds. At this point, the head is lifted off the floor, which also means the muscles behind the neck are stretched. The rolled towel moves directly to the C2, C3, and C4 cervical vertebrae at the top. We repeat the above technique for the second time about 1 minute. Did you know that, among the cases of herniated disc, the vast majority of cases are herniated discs at the C5 and C6 positions? If you can, relax your arms up and to the side like this. At this time, the lower cervical vertebrae C5, C6, and C7 are actively impacted by direct pressure on the rolled towel. Lie down with your legs stretched out on the floor, also 30 seconds to stretch the muscles on the back of your neck. Repeat the above technique for the third time, also about 1 minute, with the same skills above. Always combine well with a slow and deep breathing in 4 phases with the lower abdomen. 30 seconds. Lie down with your legs stretched out on the floor, head pulled up from the floor, stretch the muscles behind the neck. Now, we are going to do a technique that can be a little more difficult, especially for seriously ill people. About 1 minute. Slowly move the buttocks, up and down, change the pressure and position of the impact of the neck on the rolled towel. These movements will cause good coordination between pressure on the cervical vertebrae and stretching of the muscles behind the neck, improving the flexibility and strength of the muscle and ligament system between the cervical vertebrae, helping the cervical spine to maintain correct posture and pushing back the herniated disc. Gradually, the health of your cervical spine is thus restored and maintained over the long term. After a little rest like this, you can repeat this technique as many times as you can. Finally, lie down in this position before the end of your workout, for as long as you want. Put your forehead on the rolled towel. Meanwhile, the chin rests on the floor. Breathe regularly, slowly, deeply 4 phases with the lower abdomen. Wish you have a good practice. Get well soon. Goodbye and see you soon.